When you have a tragic loss of life, and particularly one where it was largely avoidable, it breaks your heart, first of all, but also you say to yourself, I have to redouble my efforts to keep this from happening again, and not to forget the fact that we dropped the ball. I mean, it's just pure and simple, we dropped the ball.
Most have lost both parents. Some have lost all of their extended family.
Everyone is either dead or dying.
So many people are dying of Ebola that dealing with their bodies is becoming a problem.
Others have been outcast from their communities. They simply have nowhere else to go.
Six of us were infected in our family, and I happen to be the only survivor.
7 of my members in my family got infected, and 3 of us survived.
I have 13 members in our family. I'm the only survivor.
In the middle of this village, we have Ebola victims, and they're all believed to have the virus. They're just being left here, presumably to die.
In 2014, a lot of people died of Ebola, and they were buried here. The place needs to be hacked.
Traditional community funerals are not allowed, but the body will be sealed in plastic, doused with chlorine and taken away for burial.
During the Ebola outbreak, we are having more than 50 people dying every day.
It's a devastating death rate. 4 in 10 are surviving.
People were afraid that everybody who came to this hospital died.
People used to go to my house, stone the house, calling my house Ebola house.
There has been cases where people, when they've gone home, have been marginalised within the community.
There was a lot of apprehension, there was a lot of stigma. Everybody was scared of everybody.
Could you ask the children to raise their hands if they've been orphaned?
They're calling the government hotline to say, we have infected cases, come and get us. But no help is arriving.
Well, I became infected on the 19th July 2014. That was then when I lost my late mother.
Of course, it was a sad thing to know that I was infected and I was proven positive. It was a very sad experience, knowing how dreadful Ebola is and the things that were happening around us, the experiences from other people catching up the virus. It was a very sad experience.
It was not easy for me. It was not easy at all when they told me that I'm positive, because people were saying that Ebola has no medicine. There's no medicine, there's no treatment for Ebola. So the day they told me I was positive, oh, I cried so much.
In the treatment center, I saw many dead bodies, so by then I felt so bad and think of my own, asking myself, oh, when am I going to die now? Because since I saw my colleagues dying every day, day by day, I felt so bad and discouraged.
Sierra Leone is in the west coast of Africa. The majority of Sierra Leoneans have never heard of Ebola. As a very poor country, in the first place, our health delivery system is not very good, it's very weak. And we had this new disease a lot of people didn't know about. So it was kind of overwhelming, both for the healthcare delivery system, even the international community, starting with WHO. I mean, everybody was just running around, not really knowing what to do, how to respond effectively. So everybody was scared. Nobody wants to die. You don't want to get infected with a virus for which you don't have any cure.
It was not easy to get there. Most of the airlines were stopping flying there. So in order to get to Sierra Leone, I needed to do multiple connections in order to finally arrive to the capital of Sierra Leone. The first thing that I saw when I got there, there were people there not touching, no touch country. So that means no shaking hands, no hugs, no kisses. Everything was a dialogue or talking just by a certain distance, and people were very scared.
AHF had a presence in Sierra Leone. We've been working there for a couple of years, and specifically we had hired the only virologist in Sierra Leone, Dr. Khan, to head up our program. So when Ebola hit, he was pressed into action to help combat the Ebola outbreak there. Then very tragically, we learned that he had contracted Ebola, and we were trying to help to get him to a place where he could get treatment, but unfortunately he died before he was able to be airlifted to South Africa. A lot of what we were doing in our response was really about education of the community, because the spread of it really came about because, first of all, the government did not tell people what was happening, and then they gave them a lot of misinformation about it. So a big part of our job was to tell people in the community what was putting them at risk, and particularly it related to burial practices. It's tradition there for the loved ones of a person who's died to wash the body, and that caused a lot of the cases. So we sent people out into the affected communities to advise people in the community not to touch the bodies. I mean, it's very, very difficult for family members who are losing someone they love dearly to be told to treat the person as if they're contaminated and to not touch them. I mean, at a moment when somebody's dying or even when someone's dead and you're saying your last goodbye, to be denied the ability to embrace them is heartbreaking, but it was very, very necessary. The majority of the people who died of Ebola in that outbreak could have been saved if the proper precautions and proper response had been in place. For example, the WHO, which is primarily responsible for health on an international basis, they didn't arrive for a long period of time, and when they did arrive, they didn't have the right equipment, and then as a result, they pulled their entire team out.
Ebola was first discovered on the 22nd of March in Guinea. On the 1st of April, Médecins Sans Frontières, Doctors Without Borders, MSF, said that this was unprecedented. It wasn't until the 8th of August that the WHO announced that this was an international disaster.
Shortages forced hospital staff to use ill-fitting gloves and plastic packaging in an attempt to protect themselves from one of the world's deadliest viruses.
We had an extreme shortage of, say, body bags or personal protective equipment. We had a number of bodies lying outside in the rain with no body bags.
Well, there's no question in my mind that the slowness of the response, the delay in the response, the disorganization of the response on the part of the World Health Organization had some very dire consequences.
We started to criticizing publicly the response from WHO, but to our surprise, we received more people and more agencies concerned on the same thing. And there was a problem there also about WHO not being accountable to the global health community. By mandate, WHO is accountable only to governments, and this is a real challenge, because if a country, a government doesn't want to recognize that they have an epidemic of global health concern because of different reasons, tourism, investments, people flying there.
Emails show the organization delayed declaring a public health emergency by 2 months. The reason? One document shows there were concerns a declaration would hurt the economies of African countries impacted.
Then WHO doesn't have a mechanism to properly take into account the concerns expressed by civil society.
Our people are sick, people die every day. Like when you go, so I don't know what to do, I'm confused.
And you call ambulances, you call police, no one does anything?
Nobody.
Actually, in the case of Ebola, the first ones to raise the voice saying there is something happening here was MSF.
This is a transnational crisis with social, economic, and security implications for the African continent. It is your historic responsibility to act now.
And they didn't receive proper response from WHO. Actually, WHO acted like, okay, that's not valid information, and they were not getting the official information from the government either. So that make WHO even take a longer time in order to declare a public health emergency there. And that's one of the reasons we decided to act, because they were not taking into account civil society voices.
In the ETU, you see everybody struggling for his or her life to be saved. Everybody thinking about, how am I going to make it here? I don't see my family member. All I see is the nurses, the doctors treating us.
During the time that I was working for AHF, at that time the hospital was very scary. In fact, people don't even walk on the streets. They thought that there is Ebola everywhere.
We don't touch each other. We are afraid of using our bare hands to treat patients. But we are willing to come to work to minimize the death of our colleague.
At the beginning of the outbreak, we knew that healthcare workers were particularly at high risk. So we wound up sending in over $1 million worth of masks, gloves, boots, and other protective gear. And prices were quite high for that equipment, but we felt that that was what was most needed.
When someone is getting diarrhea, vomiting, I think the next thing you should help the person is by giving that person an IV fluid. But no IV fluid was given to us, except drugs to control the fever, the headache, and pains.
The cleaners, too, were hardworking, but because we were very uncontrollable with our fluid, even if they cleaned the place was never clean.
In the ETU, you see someone who you talk to, in the next few minutes, you see that person in the body bag being carried outside into the mortuary. You feel the same thing that, oh, I'm going to die. It's really, really sad experience.
So, I mean, it's been well documented in a number of different studies how poor the response was. But, I mean, it was a combination of factors that led to the spread of the disease. Covering it up, not giving people good information, the lack of equipment, poor health resources to begin with. I mean, the turning point was really when they put a 72-hour curfew and they said everyone should stay at home.
In Sierra Leone, residents are facing a government order to stay inside their homes for 3 days. In a country of 6 million, it's an unprecedented effort to combat Ebola.
These are the steps authorities are stepping up in an attempt to prevent the disease from spreading further and allow health workers to identify cases in the early stages of the illness.
We can build treatment centers forever, and it still won't be enough because it will keep continuing to be passed from person to person. So we have to do more than just treatment. We have to also stop the transmission.
And they actually went door to door to find the people who were sick or the people who had died, and that began to abate the crisis.
The day that I was confirmed negative for Ebola, it was a very happy day for me. In fact, I went off for 5 minutes. I didn't know what to do and what to say.
That was my first day to jump at a distance and drop on the ground, say, going, because that day was so happier to me, going back home.
I was very, very happy. I was very happy thinking of uniting myself with the community and my family back.
Well, I feel great. I feel like a hero. It's wonderful to get admitted in Ebola ward, and with all the experiences that you survive again, I feel like a hero, and I'm proud of that.
Ebola was declared over, I think it was March 17, 2016. But we have survivors. You have spoken to some of the survivors, and most especially we have orphans what is happening to those orphans. I have personally have an opportunity of talking to some of the orphans. Some of them are still on the street. Some are with very distant relations. Some are with friends, not even being able to go to school, not having the basic medical support that you're supposed to get. So maybe these are some of the things we need to begin to look at now. In as much as, yes, I mean, we are putting in systems in place just in case there is another outbreak. But then there are survivors. We need to see how we can support those survivors, especially the orphans.
In West Africa, there were more survivors of Ebola than we've ever had before. So we're learning that there are lifelong consequences, a lot of them having to do with the eyes and other manifestations.
My bones are paining me as I'm sitting here. I'm feeling pain all over my bones.
Joint pains, at times severe headache.
My eyes, even now, I just came from the hospital, I don't need to see, so complications are there. We need more. There are many complications, sir.
So I think one thing that's very, very important is to do further research to the long-term effects of Ebola.
Right now there is a need to raise the voice again because the survivors of Ebola, they need care. They're facing either stigma or some other consequences after Ebola. So the global community, they need to take care of that as well.
One day when I went to the market, somebody pushed me. Don't come near me, you are an Ebola survivor. I cried.
Everybody go away from me, even my friends. Don't come to us, don't talk to us. You still have Ebola.
After 3-4 months, I did not work. When the day I came to my working place, all my friends go away from me. I was alone, seated for the rest of the day.
Your money has Ebola. We cannot accept your money.
People, the community members, even some of my family, they were very afraid because thinking that I will not even spread Ebola to them again. That stigma is taking our system down.
I don't think we've learned very much from the Ebola outbreak, or we've done very much. I think what you have to start with is we need a total restructuring of the global health apparatus, particularly as it relates to infectious diseases. I mean, we need to be able to get into action quickly. We need funding. We need stocks of medication and protective equipment that are kept in different parts of the world in case these types of things happen.
This is not just about Ebola, but Ebola shows us a lesson. So if the global health community is not aware of what happened and why thousands of lives were lost, that means that we are not listening and we are not learning from the past. Therefore, the history about what happened in these 3 countries needs to be known in order to be better prepared for the next crisis that will happen sooner or later.
I have to say the world owes a tremendous debt to MSF. I mean, MSF really was the frontline response in Sierra Leone. And I think it's interesting that a non-governmental organization was the one most responsible for stopping the spread of Ebola. And I think that showed the importance of non-governmental organizations, particularly when it comes to gaining the trust of communities. And also I think that we have to bring better talent to the arena and not put political people in charge of these institutions, but people who really are at the forefront of the science and who really have the experience in running large-scale health operations. I really have to salute our staff there, particularly our head person there. Her name is Miata. And I really have to take my hat off to AHF's advocacy staff, Jorge Saavedra, Terry Ford, Miata, as I said. We really called this to the attention of the world community. And one of the things we did was that we used our entry into the Rose Parade to have a float that honored the Ebola first responders. And we had the family of Dr. Khan on that float, and that brought a lot of attention to the issue. I hope eventually that there will be a global convention on public health and specifically in infectious diseases, but there does not seem to be the will at this point. It's one of those areas where a small amount of money and a modest amount of attention could save so very many lives.